When the economy went bad in 2008, I noticed that a lot of my regular patients stopped coming so regularly. Only half my patient base has dental insurance through their employers. Most people don't have dental insurance. I know that a lot of people are surprised to find out that the majority of the world doesn't have dental insurance. And I feel kind of sad about that because I feel that dental insurance has done a number of things that allow people to not have the best possible health in their mouth. Number one, people who have dental insurance tend to only do what their insurance will quote unquote pay for. Unfortunately, the dental insurance limit of $1,000 per year is the same limit that was in 1960 when dental insurance was first introduced to the population. Dental insurance isn't really insurance. It's simply a benefit that the employer and the employee pay into to a third-party insurance company, and the insurance company will sometimes give some of the money back for dental treatment. Unfortunately, there's often a lot of limitations on that treatment. So my patients with dental insurance often aren't getting the care that they need because they're limited by the fact that they have dental insurance, the insurance has limits, and they feel that they have limits as well. On the other hand are my patients without dental insurance. They feel that everybody else has dental insurance and that they can't possibly afford to come to the dentist, and so they put treatment off until they actually have a problem that's painful. Unfortunately, the best way of doing any kind of dental treatment is to catch them something early and proactively, and that's often a time when a new cavity or a small crack in the tooth isn't painful at all. By the time people wait until something actually hurts, it's usually a fairly expensive problem to fix, or you take the easy way out and have the tooth extracted. It's less expensive now, but it's more expensive later if you decide to replace the missing tooth. So many of my patients who don't have dental insurance avoided coming to the dentist when budgets got tight, jobs got cut, or they changed jobs, their insurance changed, they dropped insurance, and it just got them out of the habit of going to the dentist regularly. I decided that I was going to try to do something different. I talked to my patients for years about the limitations of their dental insurance, but people are still sure that they need to have dental insurance. I've even had patients call my office and tell me that they couldn't go to the dentist because they didn't have dental insurance, not understanding that they could simply come and pay for a preventive care visit. And preventive care visits for a year would be under $300, which is less than the cost that most people are paying into dental insurance. But no matter how much I talked, nobody would listen because they're sure that they need to have dental insurance. All right, I give up. I'll have dental insurance. I created a dental benefit of my own called Smile Shares. Now, many people in our area are familiar with farm shares, where you make an initial investment into a farm so that the farmer can plant the crops and take care of the crops during the season, and then at the end of the season you reap the benefit of sharing part of the harvest. My Smile Shares is something like that. Rather than paying your dental budget money to a third-party insurance company that's out of state, who takes your money and then tries to avoid giving it back, I actually have the plan with Smile Shares that's within my own office. It involves no third party. When you buy a membership at my office through Smile Shares, you actually support the office, my staff, my local people, and the services that we give out into the local community. And by making the investment here, we're going to be able to better take care of you in the future. Part of the Smile Shares is that the preventive care is covered with 3 basic levels of care. The care starts at $299 per year for our basic plan. That's less than $1 a day to take care of all your dental preventive needs and also save 10% off any treatment that you need to have done. If you use the higher levels of plans, not only do you get your preventive care, you get something that a lot of people are interested in. Whitening, it's included in the higher levels of the plans. Also, more frequent continuing care, more frequent cleanings, as well as saving 15 or 20% off the treatment that's done. There's no upper limit on the treatment that you can have done at Strong and Healthy Smiles. The Smile Shares covers any treatment that I do here in the office, and it gives you anywhere from 10 to 20% off depending on the level of plan you have. In addition, if you have family members receive an additional percentage off of the of the membership plan. So the first family member pays the full fee, second family member pays 25% off, and the third and beyond family members will pay 50% of the cost of our SmileShares plan. It really makes preventive care quite affordable for families and also for individuals. You don't have to be part of a company, you don't have to be part of any group to belong to SmileShares. SmileShares is for my patients who don't otherwise have dental insurance, who need a cost-effective, affordable plan to keep their teeth healthy and also to treat any problems that come up. So come to Strong and Healthy Smiles and learn more about SmileShares to see if it's right for you.